Are you or a loved one living with a chronic autoimmune condition? Have you heard about biosimilars and wondered how they fit into your treatment plan? Today, we're diving deep into Simlandi, an interchangeable biosimilar that's changing the landscape of autoimmune disease management. Simlandi, known generically as adalimumab-ryvk, is a groundbreaking medication. It's an interchangeable biosimilar to Humira, designed to combat pain, inflammation, and skin symptoms in various autoimmune conditions. Simlandi belongs to a class of drugs called TNF-alpha inhibitors. Biosimilars are biological medicines highly similar to an original product. An interchangeable biosimilar, like Simlandi, has undergone rigorous testing. This means pharmacists can substitute it for the reference product, Humira, with the same confidence in its safety and effectiveness. Our immune system usually protects us from harm. However, in autoimmune disorders, it mistakenly attacks healthy tissues, causing inflammation and damage. Simlandi targets a specific protein called tumor necrosis factor, TNF. TNF is a key player in the inflammatory process. By blocking TNF, Simlandi helps to reduce the overactive immune response. This action effectively lessens pain, inflammation, and skin symptoms associated with these chronic conditions. Simlandi is FDA approved for a wide range of chronic autoimmune diseases. It offers relief and improved function for many patients. For adults, Simlandi treats moderate to severe rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. It helps reduce signs and symptoms, slowing structural damage and improving physical function. It also addresses moderate to severe hidradenitis suppurativa, Crohn's disease, and ulcerative colitis. Simlandi is also approved for chronic, moderate to severe plaque psoriasis in adults. It's used when systemic therapy or phototherapy is beneficial. Additionally, it treats non-infectious intermediate, posterior, and panuveitis in adult patients. For children aged 2 and older, Simlandi is approved for moderate to severe polyarticular juvenile idiopathic arthritis. It also treats moderate to severe Crohn's disease in children 6 years and older. Like all medications, Simlandi can cause side effects. It's crucial to be aware of these and discuss any concerns with your doctor. Common side effects may include headache, cold symptoms like a stuffy nose or sore throat, and rash. Injection site reactions such as redness, bruising, itching, or swelling are also frequently reported. These are usually mild and temporary. Some side effects can be serious and require immediate medical attention. Seek emergency help if you experience signs of an allergic reaction, such as hives, difficulty breathing, or swelling of your face, lips, tongue, or throat. Call your doctor immediately if you notice symptoms of lymphoma. These include fever, swollen glands, night sweats, joint and muscle pain, or easy bruising. Other warning signs are pale skin, shortness of breath, upper stomach pain, loss of appetite, or unexplained weight loss. Other serious concerns include new or worsening psoriasis, non-healing skin sores, or symptoms of sepsis like confusion and rapid heart rate. Liver problems, indicated by jaundice or dark urine, and lupus-like syndrome, with joint pain and chest pain, also warrant urgent medical review. Nerve problems, such as numbness or vision changes, and signs of tuberculosis, like persistent cough and weight loss, must also be reported promptly. Simlandi impacts your immune system, which means you may be more susceptible to infections. These can be serious or even fatal. Always inform your doctor if you develop any signs of infection, such as fever, chills, or persistent cough. Your doctor will test you for tuberculosis, TB, before you start Simlandi. They will also monitor you closely for TB symptoms throughout your treatment. There is an increased risk of certain cancers, including lymphoma, for both children and adults taking TNF blockers. Do not take Simlandi if you have a known allergy to adalimumab or any of its inactive ingredients. Always disclose your full medical history to your healthcare provider. Before beginning Simlandi, a thorough discussion with your doctor is essential. Inform them about any current or past infections, including tuberculosis or chronic infections. Also, disclose any history of cancer, hepatitis B, diabetes, or heart failure. It's important to mention any nerve muscle disorders like multiple sclerosis or Guillain-Barré syndrome. If you have a latex allergy, are scheduled for major surgery, or have recently received any vaccines, tell your doctor. Children using Simlandi should be up to date on all childhood immunizations before starting treatment. Discuss your travel history, especially if you've visited areas where certain infections are common. Be aware that Simlandi may cause a rare, fatal type of lymphoma, particularly in young men with Crohn's disease or ulcerative colitis. Your doctor can assess your individual risk. If you are pregnant or planning a pregnancy, inform your doctor. It is not yet known whether Simlandi can harm an unborn baby. If you use Simlandi during pregnancy, ensure your baby's doctor is aware, especially before any vaccinations. Breastfeeding while on Simlandi may not be safe. Discuss the risks and the best feeding options for your baby with your healthcare provider. Simlandi is administered as a subcutaneous injection, meaning it's injected just under the skin. It comes in either an autoinjector or a pre-filled syringe. Your doctor will determine the correct dose and frequency based on your age, condition, and its severity. A healthcare provider will teach you how to properly administer Simlandi yourself. Do not attempt to use it until you fully understand the instructions. Always prepare your injection just before use. Do not use the medicine if it appears cloudy, has changed color, or contains particles. Allow the autoinjector or pre-filled syringe to warm to room temperature for 15 to 30 minutes before injection. Never use heat sources like hot water or a microwave. Choose an injection site on your thighs or abdomen, avoiding the 2 inches around your navel. Rotate injection sites each time, ensuring each new site is at least 1 inch from the previous one. Never inject into skin that is red, hard, tender, damaged, bruised, or scarred. Do not inject through clothing. After use, dispose of needles and syringes in a puncture-proof sharps container. Follow local regulations for disposal and keep it out of reach of children and pets. If you miss a dose, inject it as soon as you remember. Then, resume your regular schedule. If you're unsure, contact your doctor or pharmacist. In case of an overdose, seek emergency medical attention immediately. While using Simlandi, avoid injecting into bruised, red, tender, or hard skin. It's also wise to avoid close contact with people who are sick or have infections, as your immune system is suppressed. Do not receive live vaccines while on Simlandi. Live vaccines, such as measles, mumps, rubella, MMR, polio, chickenpox, or shingles, may not be effective and could pose a risk. Discuss any planned vaccinations with your doctor. Certain medications should not be used with Simlandi. Always inform your doctor about all prescription and over-the-counter drugs, vitamins, and herbal products you are taking or plan to take. Specific drugs to discuss include abatacept, etanercept, anakinra, azathioprine, and 6-mercaptopurine. Also, mention certolizumab, golimumab, infliximab, and rituximab. This list is not exhaustive, so a comprehensive medication review with your doctor is crucial to prevent potential interactions. Simlandi's active ingredient is adalimumab-ryvk. Inactive ingredients include polysorbate 80, sodium chloride, sucrose, and water for injection, with pH adjusted by sodium hydroxide and hydrochloric acid. Store Simlandi in its original carton in a refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius. Do not freeze it. If it freezes, discard it. Avoid extreme heat or cold. When traveling, Simlandi can be stored at room temperature, up to 77 degrees Fahrenheit or 25 degrees Celsius, for up to 14 days, protected from light. If not used within this 14-day period, it must be discarded. Always record the date you remove it from the refrigerator. Simlandi is an interchangeable biosimilar to Humira. Biosimilars are biological products that are highly similar to, and have no clinically meaningful differences from, an existing FDA-approved reference product. An interchangeable biosimilar, like Simlandi, has met additional FDA requirements. This means it can be substituted for the reference product by a pharmacist without the prescriber's direct intervention, depending on state pharmacy laws. Other interchangeable biosimilars for Humira include Abrelata, Amjevita, Siltizo, Hadlima, Hulio, Hyrimoz, and Euflima. There are also biosimilar products that are not designated as interchangeable, such as Idacio and Usimri. These can only be dispensed if specifically prescribed by name. This distinction is important for both patients and healthcare providers.